Good morning, me again. So we're going to carry on a little bit with the post-stroke depression thing. So I briefly covered vascular cognitive impairment and fatigue. So I'm going to do a video on each specific just to do each of those topics some justice. So today's video is going to be specifically about vascular cognitive impairment. And then I'll do another video later today, if not tomorrow, on the fatigue portion of the stroke. So, as we discussed last time, vascular cognitive impairment means your brain is impaired because it's not getting the right blood flow for whatever reason, right? Obviously, if it was a hemorrhagic stroke, right? Hemorrhagic meaning you're bleeding into your brain. There's going to be larger issues due to blood flow, right? And if it's a ischemic stroke, which is basically the blockage, there may have been a blockage to a specific part of the brain, right? Which can cause other issues. Now then, when it comes to some of what you need to know when it comes to your post-stroke world, you have a couple of things you need to know. Now, I'm going to leave the links to the resources in which I found a bunch of stuff. Some of the links are the same, some of them are not. So we're going to go through what vascular cognitive impairment is and some of the things that can mean. So VCI, or vascular cognitive impairment, makes reference to all forms of cerebral vascular disease, including stroke and dementia and other things, right? So VCI prevalence gets reported depending on the time in the stroke, the number of strokes. So obviously, if you're on stroke number other than 1, successive strokes will end up exacerbating the possibilities of having vascular cognitive impairment. Right? Now, the acute phase of post-stroke is anything from the day of the stroke up to 3 months. Right? And also can include up to 14 years after the stroke. Fun reading that. Now, obviously, it's more likely to be more prevalent, or more likely to be a likelihood that you'll have vascular cognitive impairment immediately after the stroke. And because of having vascular impairment, you are now at a greater risk for dementia. So if you already didn't have some of the risk factors for dementia, guess what? Spot a ticket to it. Yeah. And if you happen to have more than 1 stroke, right, again, your rates double with every successive stroke for having a possibility of dementia due to your vascular cognitive impairment. Now, working on that Canadian document about stroke recovery, the 2015 update, your vascular cognitive impairment could be presenting in many ways. And again, you need to be screened for this. And could your vascular cognitive impairment simply be a headache? Yes, it could. Could your vascular cognitive impairment go from headache to dementia? Yes, it could. So, because strokes are so unique to the individual, will you have vascular cognitive impairment? Possibly you may. I would probably assert, and I'm not a doctor, I've only played one on TV, I would possibly suggest that every person that's had a stroke will have some form of vascular cognitive impairment. How long-lived will that be? How impacting will that be? What will be the necessarily your outcome will not be the same as someone else, and there's no guarantee that you're actually going to get dementia. So, it is a possibility. So again, all patients that have had a stroke or TIA should be considered at risk for having vascular cognitive impairment. Now, if you have significant risk factors such as neuroimaging findings of a covert stroke, it's like a ninja stroke, white matter disease, hypertension, diabetes, atrial fibrillation, other cardiac diseases, sleep apnea, right? You should also be considered screening for vascular cognitive impairment. Specifically with patients that have cognitive, perceptual, or functional changes, right? Now, cognitive thinking, perceptual, how you deal with the world, and functional, how you deal with the world when you're in it, right? Now, there might also be some executive functioning or functionality issues. Now, what does that mean? You may have inhibition shifting, right? Insight, planning, organization, judgment, problem solving, abstract reasoning, social cognition, right? So you might basically a drastic personality change, right? And that is a possibility with also a stroke, is having some kind of personality impacting event, right? Where your personality changes, or maybe not drastically changes, but it kind of gets a tweak, right? So you may find with some of your post-stroke behaviors, right? You may have poor judgment. You may be a risk taker now. You may have difficulty planning, organizing things, your life. You may have judgment problems. You may not be able to problem solve. You may have abstract reasoning issues. You may have social issues, right? So there's many reasons there. Some of that, this vascular cognitive can have problems with. Now, because of you may have problems perceptually, functionally, socially, right? You now could create safety issues, right? So this may impact your daily life, right? It could impact your work life. It could impact social or school functioning, right? Are you safe to drive? Are you safe to cook, right? Are you safe to get out of bed on your own, right? Do you need a hover round, right? Do you need one of those bathtubs that have a door in the side so you can get into the bathtub without having to step over the tub and you now sit in your bathtub, right? Are you going to forget you put something in the oven and walk away, or something on the stove and walk away, right? So there's many things that the vascular cognitive impairment, and I appreciate the vascular cognitive impairment could happen with events other than a stroke. But if you've had vascular cognitive impairment, that is not just simply a headache, and unfortunately may drastically impact your world. It may require some help, right? Be that like a personal support worker to come in and help you, up to and including you may need to go into some form of structured living assistance, like a nursing home or whatever the case may be. So that's something you may want to consider, right? Especially for friends and family. You may need to help have that conversation with your loved one that's recently had a stroke, because no one wants to admit that they can't take care of themselves. No one wants to admit that I can't go back to my home. Through my grandmother, I saw after her stroke, she knew she was in a hospital, and she knew she wanted to go home. Stubborn old bird, but it was not practicable. There's no way she was going home. Now, with your vascular cognitive impairment, you need to consider, are you having communication issues, speech and language, vision or hearing deficits, delirium, hypoarousal, and any other meds that might have a impact on your thinker and how it works. So, unfortunately, you're going to be on at least 3 medications because of your stroke. You may be on other medications historically, or because of the stroke, may need new medications. So, are your medications now impairing your judgment, or how you think, or relate to the world? Do you consider, or do you continue, to have speech and language issues? Do you have a low arousal state, or are you hyper aware of everything, right? So there's a lot of reasons there that you might want to consider. You need to be screened for vascular cognitive impairment, right? And if you have vascular cognitive impairment, this goes back to post-stroke depression, right? They go hand in hand, right? My thinker doesn't work so well. My thinker doesn't like me. I don't like it. It tried to kill me. I can't talk the same. I don't move around the same. My life sucks. So they kind of play off on each other. And then the impact and presentation of vascular cognitive impairment does evolve over time. All patients should be considered at risk and screened or assessed periodically to detect changes over time in cognition, perceptual deficits, depression, and or changes in functioning, right? So just like post-stroke depression, you need to check yourself on a fairly frequent basis. What is that basis? It's individual, right? Again, we'll go back into the changes of state of care. Anytime you transfer from one state of care or ability to another, you may want to see if you're being impaired, right? If you're not, continue moving on. If you are, you need to seek help. Now, big problem with vascular cognitive impairment, age. The younger you are, the more resilient you are, right? The older you are, the not so resilient. So, and some of these deficits may not appear immediately, right? So, when you're talking about vascular cognitive impairment, just because I had my stroke on the 21st of June, 2018, does not mean I'm going to have my vascular cognitive impairment or the depth of it in 2018 or 2019. This could bite me in the ass in 2032. Fun times, right? Or it may never bite me in the ass at all. My vascular cognitive impairment could be just my headaches. I am so hoping it is just my headaches, right? So, and you need to look at how was that impairing them, right? How socially, how academically, how occupationally, how functionally. There are many reasons to look at the actual impairment and the deficits, limitations that's creating in that person's life, and then you have to strategize around that. Now, for treatment, you need to consider a couple of things. One, age, right? So obviously, if you're declining in years, and your vascular cognitive impairment may have nothing to do with your stroke, right? It may not. Your vascular cognitive impairment may have more to do with the fact you're getting old and there are old age things going on. You have what some doctors might call the dwindles, right? So, that being said, the younger you are, right, versus the older you are. You then want to look at and be patient-centered in the treatment. So what exactly do you have as an expected outcome, right? Do you intend to do fill in the blank, right? Do you intend to continue fill in the blank, right? Now, vascular cognitive impairment, again, can reach to dementia, right? And that is a place I can completely appreciate no one wants to go. Now, you may have memory impairment due to your vascular cognitive impairment. Initially, after my stroke, in the first 3-ish weeks, 4-ish weeks, my short-term memory was just a write-off, right? And that's vascular cognitive impairment. Or I'm a man. It's birth defect thing. I'm going to go with the stroke for now. So you may have to come up with some strategies initially to help you with maybe your short-term memory. Maybe your long-term memory's been impacted and some of your childhood memories are corrupted, contaminated, confused, collided, combined with other ones, right? So there's many things that your vascular cognitive impairment initially could present at. Just because you've got a crappy memory does not mean you're getting dementia, right? And just because you initially have a crappy memory does not mean you have dementia or it's even a relative possibility at this point. You've just had your stroke. Now then, if your memory issues have longevity, right? 6 months or longer, right? 6 months or longer, right? And or your memory issues appear to be getting worse over time, right? At that point, you might need to be screened for dementia, right? Or other issues. But definitely initially post-stroke, the first 3 weeks or so were probably the roughest for me with memory. It was, how do you get to Swiss Chalet, Michael? I don't know. I know where it is. I can tell you exactly where it is. Don't ask me how to get there. What do you want for lunch? Well, we've just had a 10-minute conversation in the restaurant. What you want for lunch? I can't tell you what I want anymore. I don't know. Right? So, exactly how is your post-stroke, vascular cognitive impairment going to impact you? I can't say. But what I can say is it is normal, right? And there are many things that can be done for you to help you. There's, a lot of things that go on after your stroke initially, and it kind of feels like you're juggling fish. Not a very pleasant experience. Okay. But you need to consider that there's a few things. Immediately after your stroke, your memory's going to suck, right? You're going to have some functional concerns. You might have some perceptual concerns. You might have some executive concerns. You might have some social concerns, right? So your balance might be impacted. You might not be the best at cooking. You probably don't trust yourself cooking anyways. You might have headaches. You might have memory issues. In the initial post-stroke, like 0 to 3 months, normal, right? What will be normal for you? I can't say. What I can say is this: if it overlaps beyond the 3-month period, then you need to go back to your clinical team and have an open and honest conversation. Like, hey, listen, these headaches are here to stay, right? Or these, I still have problems with balance, or I still have problems with fill in the blank. End of the day, the biggest thing is you need to be realistic with yourself, and your family members and friends need to be realistic with you. So if they happen to notice things that have longevity, at that point, definitely you want to make sure that you reach out and you have the conversations you need to have. Right? Because vascular cognitive impairment, it's a thing, And we don't want to see the VCI, vascular cognitive impairment, lead to bigger things, right? Now, on that note, if you happen to have liked what you've been watching over the last 2 months, right, please like, share, subscribe with your friends. If you know someone that's had a stroke, please, you might want to refer them to this channel. It might help them out because it's already helped at least one other person than myself. And if you happen to see either in yourself or someone around you the signs or symptoms of a stroke, that being facial droop, inability to raise both arms equally or effectively, slurred, stuttering speech, inappropriate word usage for situation or context, inability to smile equally effectively or at all, inability to stand unaided, general body weakness or weakness on one side, please immediately place that person in a position of comfort and dial 911. Something so simple could save a life.